Good afternoon, you all. So I will continue by talking about the subtypes and the types of the iron overload. Basically, we have the iron overload types. We have four types. We have the hemochromatosis. As she mentioned, the hem means blood, the chroma means color, and the osis means disease or the condition. And the second type, we have transferrin and ceruloplasmin deficiency. Third type is ferroprotein disease. The fourth type is aciduroplasminemia. I will more focus about the hemochromatosis. We have three subtypes here. We have the neonatal, the primary, and the secondary one. Also, we have four subtypes of the primary hemochromatosis. For the type 1, this type is the most common of iron overload, which in the male, it's causing the male between the age of 40 to 60. It also affects the woman, but they will be affected after the menopause, or we can say after the stopping of the menstrual cycle. The second type is also called as juvenile onset disorder. This type also causes children more likely, according or comparing to the adults, and it can affect the sex hormones. Like in the male, we have the testosterone, which is a high level, but for the we also have the female, but in a low level. We have the estrogen and the progesterone hormones in the female in a high range, and also we have the very low range in the male. The third type is in between or intermediate between the first type and the second type. And the fourth type is more like connected to another health problem or another condition of health, which is not related to some mechanism of the storage of the iron, but maybe a condition could cause that iron overload. But there are also other factors like diet. Maybe the individual is consuming too much or high amount of red meat, which we also know or we are familiar with it, that red meat contains a lot of iron that if we consume it too high, maybe the body cannot consume it or metabolize it to use the proper amount of iron. And also we have another factor, which is medications, that some medication can promote the iron overload or the excessive iron storage. And the secondary type and the secondary type is also similar to the primary. And the neonatal one is like the parents, they have the problem within the liver. The parents have some problem that they will produce antibodies for the fetal when they're growing up, that they will attack to the liver cell and prevent the storage of the iron, but sometimes can overload happen.